Hello, biohackers, and welcome in Biohacking Podcast. I'm Biohacking Adam, and my guest speaker today is Dr. Masha, my mentor and expert in naturopathy and biohacking protocols. And today together we will talk how to combine biohacking treatment and how to get maximum effects and start those positive changes in the life. Today we are again with Dr. Masha, and we will dive into the biohacking treatments. What biohacking treatments are, we can call it like most effective, in your opinion, Dr. Masha?
It's an excellent question, Adam, because the answer to this question, the treatments that are most effective for you are the most effective treatments. In other words, it has to be an individual decision. It has to be a personalized protocol. But we can talk about the therapies. They can work for all different kinds of people with different kinds of problems.
Sure.
That's an approach I think that we can take. Of course, hyperbaric oxygen therapy. We talked about it in great detail in the previous podcast that we recorded. So if anybody wants to check it out, it's available.
Yes.
Right, on your platform. Also, red light therapy is a great choice. And I should say, if hyperbaric oxygen therapy is my number one choice, red light therapy is my number two choice. I absolutely love it. I use it every day, several times a day.
Great.
Helps me recover. I can share just now. I did something that's called brain tap, and it's a combination of vibration, light, and sound therapy. So whatever I do, light therapy is always included. So red light therapy is a name for it. Another name for it is photobiomodulation, because in fact, light therapy is not just red light. It can be blue light or even green light, white light, all kinds of colors, right?
Yes.
They're all on the spectrum. So we can use those. So definitely hyperbarics, definitely red light. I love supplements.
Okay.
Wow. So this is huge. I like all kinds of therapies that can bring benefit, but you cannot do all of them because we have limited access, and we also have to make financial decisions.
Yes.
Right? When we choose, if we lived in a perfect world, we would do everything, without limits. But right now we can't, so we have to make those choices.
Absolutely, yes. I understand this, and the best, I think, way is to try and take this as a beautiful journey, and just add the new thing into our daily routines. Try some red light. Also, as we mentioned, supplements. I believe that supplements are working really well, but after some time of consuming the supplements, our body is like filling up, and we need to do a little bit break and give that rest, and then jump to the another supplements and discover another benefits for our health, basically. Yes, great. About the red light. Red light is, I'm curious about red light, because this therapy can be used every day. Is that right? And what is the effectiveness of the therapy?
So let's talk about red light, but first let's go back to your previous question. So how for a person who is just starting, or maybe who is in the middle of their journey, how for them to decide which therapies to use? So first, there is actually an approach to that. So first, they need to look into their health situation.
Yes.
What are their health problems and what are their health goals? Then they need to look at the available therapies. Yes. Maybe they have a clinic in the vicinity. Maybe they have a friend who has a hyperbaric chamber. Maybe they have a red light panel in their home. Those are the ways to access those therapies. So first, they need to do the health assessment, then what therapies are available, and then have a map which therapies will bring them faster to their health goals. And that's how we decide. And that's why I said that it's an individual approach. So let's say I have access to hyperbarics and my goal is to improve recovery. So I'll do that. Maybe your goal is to improve muscle soreness and you have access to red light therapy.
Okay.
So you can do that, right?
Sure.
So we have choices there. And that brings us to your next question about the red light therapy. So let's talk about that.
Yes.
In my journey, I discovered hyperbarics first.
Okay.
And it was all about hyperbarics. So I did it every day. I recommended to all of my clients, all of my patients. I was mesmerized by results. And then I learned about red light therapy.
Sure.
And I'm very cautious with the new things. So this is the way I am. So I started to use it just little by little, first on myself, then on my family members, of course. And then I started to include set of my clients. Now I think I recommend it to almost everyone because there are very few contraindications to red light, which means almost everyone can use it. Mm-hmm. Now, the benefits are absolutely amazing. And let's talk about the benefits. First and foremost, if somebody has any kind of pain, they do red light.
Sure. Mm-hmm.
And that works as a painkiller.
Wow.
However, there's a little trick.
Mm-hmm.
So the timing, how long is the red light therapy session, matters. Whether or not you're going to get this analgesic effect at the end, decreasing pain. So longer treatments usually have those analgesic effect. Normally, our treatments are 20 minutes, right? Mm. How much time we spend in front of a red light therapy panel or a pad or whatever device we have, 15, 20 minutes.
Sure.
If you increase that to 30, 40 minutes, then you get the analgesic effect, meaning that it will take away the pain. And this is huge for somebody who has joint pain or muscle pain or any kind of pain. Pain is annoying. Mm-hmm. Pain is disturbing. It's very difficult to carry on with everyday life if you have pain.
Yes.
So you have this great device to help you with that. And there are other benefits as well. I mean, we can talk about it. It's not just to relieve the pain.
Yeah. Just the red lights sound so fascinating because we know that using painkillers, unfortunately, that bringing the side effects and is harming our body and internal organs. So just a simple hack with the red light can upgrade the health so much. That's amazing. If I can ask how we can synergize the other treatments together, how we can combine the other treatments. So let's say maybe we can do red light and hyperbaric, or I think the cryo chamber. This is the treatment that it should be used in the separate days of the recovery. Is that right?
So there are different ways that you can combine different therapies. And there's no cookie cutter approach. I think it's important to state that. It's not like there's only one way and everybody should do it the same way.
Sure.
Let's take an example of hyperbaric therapy and red light therapy. Mm-hmm. First of all, these two go really well together because they both work at the level of mitochondria. Mitochondria is super important. Mitochondria is vitality. The source of life, the vital force, is in mitochondria. So both hyperbaric, by sending more oxygen to mitochondria, and red light therapy, which works on a different part of energy production cycle, but still in mitochondria, they both optimize mitochondria.
Yes.
When mitochondria is optimized, we produce energy much better. Our immune function is 100% better.
Yeah.
Other processes in our body are a lot healthier. So both sort of work on the same thing in a different way.
Sure.
When two things work on the same thing but in a different way, we call these therapies synergistic. Mm-hmm. So they can be used together, and one will potentiate the effects of another. Another good example of that is methylene blue and red light therapy, for example. But let's stick to hyperbarics and red light. Now, you can do hyperbaric treatment and follow it with red light therapy.
Okay.
You can do red light therapy and follow it with hyperbaric.
Mm-hmm.
Or you can do red light therapy inside a hyperbaric chamber.
Wow.
So there are 3 different ways, right?
Yes.
There's no one protocol that will fit every single person. And we will choose which protocol to use depending on health situation
Yeah.
and health goals. So that's why the assessment is important. So we can map the journey of a person of getting better and which therapies to use and what we use first, what we use second. Do we stack it with a third therapy? Maybe that's also an option.
Yeah. Wow, so fascinating. So it means the red light and hyperbaric is a perfect combination, and then them 2 treatments just like supporting each other in the multiple ways. Can we ask what treatment shouldn't be combined and can cause kind of maybe even side effects or lowering energy actually in the biohacking treatments?
It's a very good question. And the answer is yes. Some treatments can be too much when done together in a particular situation.
Sure.
And let me explain what I mean. Red light and hyperbarics is an amazing combination. We just discussed that. Somebody who's had an injury, somebody who's had maybe traumatic brain injury, doing red light therapy inside a hyperbaric chamber is absolutely amazing. It's going to bring results a lot faster and maybe more profound effect. Now, imagine you have someone who has a condition with low vitality, something like chronic fatigue syndrome, or maybe a chronic infection that they've had for a very long time. Maybe HIV infection can be very well managed with retroviral therapy, yet it's a chronic infection and it takes toll on the body. So for a person like that, doing 2 therapies together might be too much of a good thing.
Okay.
And we need to bring here a concept of hormesis. I know you like this concept very much.
Yes.
So let's talk about that. Basically, hormesis says what doesn't kill us makes us stronger. So when you apply a little bit of stress, the body gets stronger. A great example of that, somebody going to the gym and maybe they're just starting, they're doing a little bit of weight, their muscle's going to grow and they're going to feel good.
Yeah.
Maybe a little muscle soreness, but nothing major. Let's say the same person goes to the gym, but instead of doing a little bit of weight, they're doing a lot of weight, like 50 kilos. Best case scenario, they're going to feel very tired. Worst case scenario, they're going to get an injury.
Yeah.
So a lot of stress will break the system. A little stress will make the system stronger. Same with any therapy that we're discussing, because both hyperbaric therapy or red light therapy, even some supplements, they can have even exercising, right? All of these things can have stress on the body, and they have stress on the body. If we apply just the right amount of stress, the body gets stronger. But if we apply too much stress, so we get on the other side of that hormetic curve, then it's too much stress and a person doesn't feel good at the end. Does it mean that we broke something, that it's irreversible? By no means.
Yeah.
The person to whom we applied too much stress or who did too many things together would probably feel not well for some time, but then they'll recover and they'll go back to their baseline. But it's something to keep in mind always.
Okay, yeah, that's so important. What we heard just now, and is I believe is about that. Slow is the best, and just enjoying them small steps and progress. Testing the limits. In some way, in a good way. If I would ask that. How to check the effectiveness of the treatment? Is there any way how we can check? I know the best way is just how we feel and how our body is giving us the signs. But is there any other way how we can test those effectiveness?
Of course we can, because we live in the 21st century.
Sure.
Right? So we're really equipped with so many tools.
Yeah.
A lot of times we have to rely on subjective measurements. Subjective is exactly what you said. Do I feel better? Do I have more energy?
Yeah.
Do I sleep better? Are my relationship improving with my loved one? Because that's also a sign of improved mental health and things like that.
Absolutely.
We can rely on subjective things, but we also can rely on objective measures. And people really like that. So we can look at different things. We can look, for example, at blood glucose.
Okay.
So somebody who was not metabolically flexible, but now they changed their diet, they started exercising, they added hyperbaric oxygen therapy, which drastically improves insulin sensitivity. We can recheck their blood glucose and see where it's at. If you want a day-to-day basis, my favorite measurement is heart rate variability.
Okay.
You can measure it with an Apple Watch or a ring. Does a really good job with heart rate variability. Apple Watch is not such a great tool for that.
Okay.
It's not as accurate. So you can, and a heart rate variability is a measurement that shows how well we handle stress. That's super important. If you handle stress well, you can do anything. If you don't handle stress, you probably not gonna, proceed with much. So that can be definitely measured. It's not a single measurement. So what we need to do is measure it on a daily basis.
Yeah.
To see, to look at the trend. Trends are important. Of course, heart rate is another one. That's a simple one. You don't even need to have a device. So you need to make sure that it's in the lower range, especially in the morning, and look at things like that. And then we see if the treatments are effective. Of course, this is if you're doing it on your own. And when you do things on your own, you have to figure out everything yourself.
Yeah.
If you go and see a specialist, somebody who specializes in these therapies, then it becomes a lot easier because you have someone who can help you with that. And both ways are doable. I mean, when you started, we were doing it on our own. But right now, if I'm really puzzled or if I'm not in a really good place health-wise, I go and see therapists, even though I'm a therapist myself. But it's a little tricky to assess your own progress, although it's doable.
Okay, great. Yeah, that's so important. And I think VO2 max is a good way to also test our lung capacity and how we taking on that endurance.
It's a great one if you have access.
Sure. Yeah.
If you can actually measure it.
Yeah. So that's mostly available for athletes, and but that's something cool. And then we need to be kind of we need to feel the vibe of the biohacking. Then everything else is just becoming nice and simple and giving us a lot of joy of doing it. Yeah, so thank you so much, Dr. Masha, for all this great knowledge. I'm feeling like I'm learning all the time new things, what is so important. And I'm sure our listeners, they had a lot of tips and information about the biohacking. But another question, if anyone of our listeners would like to find you and or have a consultation with you, how they can approach?
Oh, I'm available online. I do online consults where I explain to people exactly that, how to incorporate regenerative therapies such as hyperbaric, red light, magnetism, all these supplements, all these wonderful things into their health regimen. So we book an online consultation and we explore that. And they can go to my website. It's drmasha.com. for Dr. Masha, and we'll have that in the podcast description.
Yeah, if we can say something to our listeners, that how they can start them small steps and what they should look on first, like the most simple list of what we can do to improve our health.
So we always should start with foundations of health. And foundations of health are things that we eat, air that we breathe, toxins, both in our relationships and in our environment, exercise, fresh air, sunlight. things like that. Basic things that we don't pay enough attention to because we think they're basic.
Yeah.
We're thinking, oh, but this is basics. Give me something more complicated, then for sure it's going to work. But the foundations of health are very important because this is the base for us to build our health. And then once that is taken care of, we can think about regenerative therapies that we can use to improve our health even further. And regenerative therapies are things like hyperbaric therapy, pulsed electromagnetic therapy, the magnetism. I love that one. It's absolutely amazing.
Actually, if we can add so basically grounding is such an important natural biohack, and unfortunately we're not doing it as much. So the treatment you just mentioned is following the same kind of protocols then?
Grounding is part of magnetic therapy. Magnetic therapy is more than that. So we can use actual magnets to help us realign the cell communication. But all these therapies will have full effect when the foundations of health are taken care of. This is important. So first is sleep, food, and things like that.
Yeah.
And then we know, because we need to spend time, we need to spend money, and we need to make sure that these therapies are accessible. So we go all the way. We use hyperbaric red light and everything else. But then how much effect are we actually getting from those therapies? And this effect will depend very much on how well we optimized the foundations of health.
Okay, yeah. That's thank you so much.
It's not I'm sorry for I need to add something. It's not something that you do for a month or for 2 months.
Yes.
It's a lifestyle.
It's a lifestyle. It's the way of life.
Exactly.
Yes.
And when you start doing it, it will become a way of life, really. And there will come a point when you don't think about it anymore.
Yeah.
It just comes naturally. You go to bed early.
Yeah.
You make sure you sleep in the dark room.
Yeah.
You watch your sleep metrics and things like that. Because we value health and we think that health is
wealth,
and it's the ultimate way to freedom to do things that you love.
100%. Yes, that's amazing. Yeah, thank you so much for this conversation, for sharing with us all your great knowledge. And it was big pleasure to speak to you. And I hope we gave lots of answer to our listeners. And we're looking for more biohacking podcasts. Let's go.